Dr. Scott Sears with St. Vincent Healthcare back here on the show with us. Dr. Sears, great to hear from you. Thanks so much for taking some important time out of your schedule here to share your thoughts with our statewide audience.
Yeah, great. Good morning, Aaron, and it's great to be on the show. I love connecting with people across our great state.
Well, it's a good way to get the word out there, because I know folks, if they had questions 2 weeks ago, they've got even more questions now. There are some new headlines out this morning that hopefully we see this as if not good news, at least better news. Two headlines out of New York. Governor Cuomo there saying that the coronavirus deaths have been, quote, effectively flat for 2 days. So are they getting over the hump in New York State is one of the questions there. He's also saying that they don't need additional ventilators for their hospitals, that their needs are being met right now in New York. So that's the better news out of New York. But it seems like we even got some better news here in Montana with an update to the COVID-19 models in terms of now they're projecting fewer deaths from COVID-19 here in Montana, and apparently the peak resource needs for hospitals has been moved from April 26th to April 13th. What's your read on the current situation?
Yeah, so that is good news, and just like I think sometimes when we get bad news, we overblow it, and sometimes when we get good news, we overinterpret it. I think it's important that people understand a couple caveats with this. There's two big models. One comes out of Johns Hopkins University, and one comes out of the University of Washington. Both look at trends and stay-at-home orders and hospitalizations and track things every day and adjust their models. Models are only as good as they're built, and so they're not perfect predictors, or else we'd know everything. But what we're seeing is that in Montana, because of the early aggressive kind of shelter in place, it has minimized how much spread there has been in our communities. You know, right now you can look at different communities in Montana, and obviously Gallatin County has been the most affected, but Yellowstone has, you know, as of this morning, 47 confirmed cases. What we know is there's probably about 10 cases in the community for every confirmed lab test. So really walking around Yellowstone County, there's probably between 450 and 500 people who have had or currently have COVID, the virus. And when you look over in like Flathead County, there's 31 confirmed cases. There's probably 250 to 300 people walking around who have had it or do have it. Because it's slower spread based on this shelter-in-place order, what we see is not the peak in the number of cases coming all at once. But it's important for people to understand that that doesn't mean that there aren't going to be ongoing cases. What the great news is that the hospitals are not going to be overwhelmed with cases all at one time and then have to be making decisions about who deserves a ventilator and who doesn't. We can handle the surge of patients, but it is still incredibly important to follow the guidelines of social distancing, frequent hand washing, not touching faces, keeping your face covered when you're in close proximity to other people, because this virus still is present. It still will spread. It just won't overwhelm the hospitals. And that's what the governor of New York is saying as well. It's gotten flat. So they're not overwhelmed. They're not running out of ventilators. But that doesn't mean people aren't dying and that new people aren't getting the disease and getting very sick. So I don't want to temper the enthusiasm, but I also want to give it in the context of what it really means.
No, that's perfect. Yeah, because we never want to overinterpret any of these, one way or the other. On the phone lines, first up, let's go to Kevin in Billings. Kevin, did you have a quick question or comment for Dr. Scott Sears?
My question is, have the non-COVID flu doctor visits been reduced because of the social distancing and shelter-in-place directive?
So have the non-COVID flu cases also been reduced? Okay, Dr. Sears, your thoughts?
Yeah, this is a fantastic point. I'd be interested in where you got that insight because it's spot on. But it's a little complicated because typically the end of March across the state of Montana, we see the conclusion of our influenza season. In addition to multiple other seasonal viruses that we get in the winter, there's a whole slew of them. And usually they taper off quite quickly near the end of March. What I do know is that very early on, meaning about 3 weeks ago, for every 10 COVID tests that we were running, about 3 to 4 of them were showing up positive for influenza. And really only about 2 out of 100 were showing up positive for COVID. So it was like 30 to 2 influenza to COVID. But over the last 10 to 14 days, we've virtually seen influenza disappear in our community, which is fantastic news. And how much of that is related to social distancing versus how much of that is related to the normal seasonal variation of influenza, we don't know. But I guess that it is a combination of both. And if we practice hand hygiene and social distancing every winter like we have this winter, the incidence of influenza would definitely go way down.
And, of course, influenza has taken a lot of lives in this country over the years as well. Kevin, did you have a quick follow-up as well on that? Or
No, just a curiosity.
Okay, perfect. All right. Well, that's great. That's a fascinating question there. Doc Sears, it kind of ties in with, I saw a friend from Helena shared a story out of the New York Times where they said, where have the heart attacks and the strokes gone as well? I thought that was kind of an interesting insight, too.
Yeah, I think the heart attacks and strokes haven't gone anywhere, frankly, Aaron. I mean, we're seeing those same serious illnesses show up in our communities. What you're seeing around our state and around the country is that a lot of local hospitals have shut down. Well, virtually every hospital has shut down what we call elective surgery. Those surgeries aren't always elective. Elective means not life-threatening. We're still performing surgeries that have to be done on people. But when you cut down some of those, quote, elective surgeries, you do reduce some of the complications that come from some of those elective surgeries and other procedures that are happening. And so you see a small decline in some outcomes, which may surprise some people and think, hey, well, where did all of these things go? When the truth of it is everything's just kind of in a lull right now because so fewer things are being done. And what we're going to see probably in the future as those things ramp back up is actually a blip or a bump up over time. So the heart attacks and strokes really have not reduced significantly. Although I will say this as far as a key point, we know that inflammation and viral illnesses and pneumonia are a significant inciter of heart attacks. And people are used to thinking about high blood pressure, high cholesterol, smoking, and diabetes. But what they don't realize is that active inflammation also increases the risk of a heart attack. And so when you try and dramatically decrease inflammatory diseases or infectious diseases, you do see a decrease in cardiac death.
There's some secondary effects there as well. Very interesting. Well, I want to talk more about the impact on the hospitals because I think that's a major story that we kind of hinted at last time you were on but didn't really get to. But we'll get back to that after this upcoming quick break here. First, let's sneak in another quick question or comment from Russ in Billings. Russ, did you have a question?
Yes, I did, and I'm pretty intrigued about the thought that these drugs they're working on now have a connection with anti-malarial drugs. Now, some people worked out of the country for years with a steady diet of anti-malarial drugs. I wonder if they're doing blood work on these people to see if there's anything there that's beneficial.
All right, great question, and that ties in with one of the questions we got on Facebook, which is, what are the doctor's thoughts on hydroxychloroquine? Seems like there's some positive results there. Why are some pushing back using it? We'll start there with Dr. Scott Sears right after this. The number for you, 294-0970. Dr. Sears, one of the questions we got on our Facebook page is, and this has been something that's been in the national news as well here. In fact, I saw there was a Democrat lawmaker out of Michigan on Fox News yesterday saying, hey, hydroxychloroquine worked for me. She heard President Trump talking about it. She said it worked for her, and she had COVID-19. What's your thoughts on treatments like hydroxychloroquine? And then we also had a previous caller who mentioned some of the anti-malarial medications. And is any blood work being done to look? What are you hearing on that front?
Yeah, I think the last caller and the Facebook question are both kind of spot on in regards to this. So chloroquine and hydroxychloroquine are both anti-malarial drugs. They were actually developed way back in the 1930s during the World War to protect soldiers actually against malaria. Malaria is caused by a parasite, not a virus. It was caused by a parasite that's spread by mosquitoes. And what's interesting is, earlier this century, 15 years ago or so, when MERS virus came out, which was another coronavirus, Middle East respiratory syndrome, at the tail end of that, they were doing a lot of studies looking for drugs to treat that, and they found that hydroxychloroquine actually had a little bit of an effect on the transmission of that coronavirus. So when this coronavirus showed up, of course, people immediately jumped to those anti-malarials, chloroquine and hydroxychloroquine, and began to do some studies on them. And it does look like there is some data that would show that there are patients who benefit from it. People really don't understand why. I mean, scientists look at that. There's two theories. One is it actually changes the acid on your cells so that the virus can't infect you as well. And the other is that it actually revs up your immune system. That one would seem to make more sense of why it would work for both a virus and a parasite. But the people don't understand exactly why or exactly how the medicines work, but it does appear as they look at it more and more that there is some effect of them. Now, what's happening is you can't take 100 people and give 50 of them hydroxychloroquine and 50 of them nothing. So these studies are not as good as if you randomized two groups of patients and truly saw if one group did better on the medicine than the group who didn't get the medicine. But there does look to be some early evidence that they're helpful, but they're only helpful and they're only used in patients who really have significant symptoms from the COVID virus. They're not useful to prevent getting infected. They're not useful in patients who are asymptomatic or those with mild symptoms at home. So right now they're being reserved for patients in the hospital that aren't getting better with supportive care, and they are showing some promise, but more trials still have to be done.
And so it sounds like kind of partly your message is one that I've heard from you before, which is don't assume that anything is much of a magic pill, or not anything, but don't assume that everything is a magic pill, for one. So, but it shows promise. But the other thing, if I'm hearing you correctly, is, hey, don't just go start popping these pills thinking it's going to prevent you from getting the coronavirus too. Am I tracking right?
Absolutely. And so you shouldn't, if you're asymptomatic, you shouldn't be asking your doctor for a prescription for these medicines to try and prevent it or to have a stockpile on hand. They are being managed in hospitals for those patients who are most affected by the illness and not responsive to other therapies.
All right. Very interesting. We're talking with Dr. Scott Sears with St. Vincent Healthcare, taking your questions for the entire hour here on Montana Talks. Next up, let's go to Tom in Victor, listening to KMPT. Tom, thanks for your call. Did you have a quick question or comment for the doctor?
I did. I was just kind of wondering if the VA system has been affected here in Montana with everything that's going on, as backup for the regular hospitals.
Oh, yeah, good question. I know I could give some of my thoughts because we chatted with the VA secretary himself, Trump's cabinet member, about a week ago or so. But Dr. Sears, your thoughts, just seeing it from your angle, and because I know at some point the Montana system could call on the VA as a backup system. What are you seeing, hearing?
Yeah, absolutely. I mean, we could, and the VA provides great services for our vets. Obviously, it would be awesome if they had even more resources to serve, that population. But when you think about who the VA services, a lot of those patients are folks who are at very high risk for complications from COVID. And so, as we've talked about on this show, one of the most valuable services the VA is providing is maintaining, excellent care of the chronic conditions of our vets so that when they do get exposed to the virus, they're able to not succumb to it as easily as they would otherwise. And I know the VA is doing virtual visits via video, just like we've been doing here at St. Vincent. They've been doing telephone visits with patients, trying to keep it so the vets who have serious illnesses don't have to show up to the facility and yet still can maintain contact with their physicians at the VA and make sure that their treatment is provided to them.
Well, in fact, when I interviewed Secretary Wilkie, the VA secretary, I think a week or so ago, it was kind of cool because after the show, I got an email from a listener in Lewistown listening to KXLO, and he said, hey, I just want to give a pat on the back to the VA in Lewistown. They just called me just to check on me, just to see how I was doing. So he thought that was pretty cool. So hats off there. But yeah, I know that they've done what a lot of other hospitals have done, which is, cancel any elective surgeries and things like that and move to video visits. So they're taking similar precautions that other hospitals and healthcare facilities are taking at this time. But when I spoke with the secretary, he said, look, even if we do get to a point where the system will be overwhelmed, veterans will come first. Dr. Sears, Tim Tharp in Savage, Montana, had a great question the last time you were on, and because we talked a lot about flattening the curve the last go around, and so I think folks get that concept now. But he said he's interested in another bubble that's potentially out there, flattening another curve, which is all of these surgeries and things that are being postponed right now. Eventually, those are going to have to happen, and that once we get through this, there's going to be a big surge and a bubble waiting. How are we going to flatten that curve of all the needs that are out there that aren't being met right now? And then on top of that, I think it makes the point that, look, these hospitals are desperately needed right now, but unfortunately, like, they're losing, I'd imagine, a lot of money because they're not able to do business as usual. So instead, they're in standby mode. Is that the sense that you get?
Yeah, this is a topic that could take up your whole week of radio show, right? Just healthcare economics in general, and we've talked about it, so your listeners are super up to speed and bright about this. But understanding how the American healthcare system works has been has had a spotlight, shine brightly on it right now, because you're right. Hospitals have had to significantly decrease the normal everyday business that they do, which is replacing knee joints, replacing hip joints, doing elective surgeries for folks that need surgery but aren't going to die without them. All of those things have had to be postponed. Well, if you understand healthcare economics, you realize that for every Medicare or Medicaid patient that gets admitted to the hospital loses money. It actually costs our hospital money to take care of our most vulnerable patients. Well, right now, the hospitals have basically shut off everybody but the most vulnerable patients. And so they're filling their beds with folks who actually cost the hospital money to take care of, and they're not able to cross-subsidize that with any of the other care or elective procedures that they typically perform. And so the hospitals around the state and around the country right now are facing huge economic challenges. They've actually had to, in the western side of the state, lay off healthcare workers because their volumes are so low. And people are like, what in the world? Why are you laying off people or furloughing healthcare workers at a time when New York's governor is begging for people to come there? Well, it's because in our side of the country, or at least in our state, we don't have the volume in the hospitals, so workers are being sent home, and that is affecting them economically. And this is going to affect hospitals going forward. And so some of that stimulus package that Trump has put forward is to help our hospitals who are having to subsidize the care that's being provided without any other revenue stream to keep them afloat. So that's a pretty simple answer to a really complex question, but very important. The second part of your question was, what are you going to do with all these surgeries that have been postponed? I have a large group of patients right now who simply can't walk because their hip joint is so destroyed that they're basically sedentary, and they desperately need a hip surgery, and it's had to have been postponed. And come June, July, August, when those surgeries are done, we're going to have twice as many people who need surgeries as we have capacity to do them. And so we're going to have to figure that out. That's a second bump or a surge that's going to come that we're going to have to figure out. How do we create more time in the operating room? How do we create more, time for our surgeons to operate and offload some of their other activities so that they can catch up on all these patients who truly are suffering because they don't have access right now to procedures that they need.
Yeah, and I've heard those hip surgeries are just amazing too. That they have you walk in the same day, and you have some pain afterwards, but it doesn't compare to the pain you had beforehand. So I've heard that firsthand from folks. Dr. Scott Sears joining us for the full hour, 294-0970. Next up, we got about 30 seconds here. Keith in Bozeman, did you have a quick question?
Yes, sir. I was offered a pneumonia shot when I got my flu shot, and I didn't get it. Was that a mistake, or would that help?
So you got a pneumonia shot instead of a flu shot?
No, I got the flu shot, and they offered me a pneumonia shot. I was just wondering if that helps you fight the virus.
Dr. Scott Sears, thanks again for being with us. The question we had during the break, if I remember it precisely, the caller said, hey, got the flu shot, but he was also offered a pneumonia deal as well, or I'm not sure if that was a pneumococcal or anyway.
Yeah.
What's your thoughts on that question?
Yeah, Yeah, good question in regards to immunizations in general. So the flu shot, as people know, is a shot every year that people need to get every year because the flu virus mutates every year. And so that's an important one to get. Usually comes out around August, September, and people should get it no later than October or November for the flu season each year. And again, that's because the influenza virus mutates every year. It's a new virus every year. They create a new vaccine every year to target that. The pneumonia shot is different. The pneumonia shot, what people need to understand is that protects against one specific kind of pneumonia called pneumococcal pneumonia. There's two different shots for it. You could consider one a booster and the other one a baseline shot, but what the shot does is it specifically protects you from getting pneumonia from one specific bacteria. Again, it's called pneumococcal pneumonia. It's the most likely bacteria to kill people if they get it with pneumonia, and we have an extremely effective vaccine that people should get if they have any kind of underlying condition like asthma, emphysema, heart disease, diabetes, or are simply 65 years of age or older. So I always encourage my patients to get the pneumonia shot if they have one of those risk factors or once they turn 65. It would not protect you from COVID or from even getting pneumonia with COVID, but it definitely would protect you from getting pneumonia from pneumococcus, and that kills people every year. In fact, as people age, it becomes a top 5 cause of death around the country, so very important immunization to get.
All right. More with Dr. Scott Sears here. Rod and Glendive, stand by because I definitely want to hear your question as well. We got an interesting question about cattle, so Rod, be sure to stand by because I definitely want to get to you. But next up in line, we've got Susan in Missoula. Susan, thanks for your call. Did you have a quick question or comment for Dr. Sears?
Yeah, I have been concerned that Montana, and I don't mean to take this disrespectfully, but we have only had 6 deaths. We have shut down our entire state. We have had a relatively small number of cases overall in comparison to other causes of death and illness in our state, including the flu. And I'd like the doctor to comment on the impact that this shutdown is having on the health of our state, not only physically, but also mentally, because this is also causing tremendous depression and child abuse and marital stress and relationship stress. So I'm curious to hear his comments on.
That's a very good point. Yeah, and basically that there's other medical issues that are going to come about because of the economic issues on top of that. Great question, comment there, Susan. Dr. Sears, your thoughts?
Yeah, there's some really good points that Susan made that affect more than Missoula. I mean, they affect the whole state and the whole country. And there is no simple answer for this. What we do know is that domestic violence is up around the board, around the country, that as people have had shelter in place and have spent more time within a small confined space, that domestic violence is way up. And we do want people to know that they do not need to live in situations where they are experiencing abuse or violence, that the hotlines still work. You can still call your physician office, and they can connect you with hotlines. And our government, at least locally, has done a good job of creating shelters for those folks to get out of abusive situations. So that's a very good point that has gone up. Marital stress has gone up around the country because of this. And I don't think just because of shelter in place, but I think the uncertainty and the unknown of how long this will go on, I think does play into people's mental health. And obviously there's huge economic impacts around our state and around the country. So no matter what happens, people are going to be able to look back and say, hey, if you would have made this decision differently, then this wouldn't have happened. It's very dangerous to kind of play those games, however, because you can't go back in time and make that different decision, and then all of a sudden you may have seen a huge spread of COVID that we would have been pointing the finger at. So I think the most important approach is to recognize that there are significant economic impacts for everybody because of this shelter-in-place order. There is an increase in domestic violence. There's an increase in depression and anxiety. And folks need to still reach out for help in those situations. And that's why these decisions to kind of reopen the economy or reopen places of businesses or schools or places of gathering are so challenging, because it's just like if you were to close a section of I-90 across the state of Montana because there was black ice everywhere, and all of a sudden people were sliding off the road and many more people were dying. When you open that road back up, people are still going to die from car accidents, and bad things are still going to happen. And so some of the behavior changes that we're learning through this crisis need to be sustained. You know, the hand hygiene, the getting your flu shot, the maintaining social distancing, the staying home from school and keeping your kids home from school when they're sick, of you staying home from work when you're sick so that you don't spread diseases to other people. Those practices need to stay in place. And if we don't fundamentally change how we behave, this is not going to be the last pandemic that people see in their lifetimes. These things will recirculate and recur if we don't learn from what we're presently experiencing.
Well, and on that point, too, I've said it on this show before, too, which is, hey, if you can work remotely right now and it's working for you and your business, why not allow that option moving forward, even as we ease out of this? But it just makes sense, because as people have to move because the spouse got the job here, the spouse got the job there, well, then you can take your job with you. And so telecommuting makes a lot of sense, especially from a Montana perspective as well. Let's see. The other thing that I find interesting is South Dakota, which hasn't done a statewide shutdown order, actually has fewer deaths than Montana. But I know that you can't always overinterpret these numbers or make, simple analogies. But I know the South Dakota governor is getting a lot of attention for saying, hey, we're going to do the right thing without a government order. Thought that was very interesting. Next up, Rod in Glendive. Rod, are you there?
I am.
Hey, thanks. Did you have a question or comment?
My comment is, in the last week in Australia, they're testing the drug ivermectin. I don't know if you've seen that study or not, but it's also a drug that works on parasites. We use it in the cattle industry here as a back pour on that works on external parasites as well as internal parasites. It's original. It's a generic. It's available worldwide. Its original name was ivermect. That the ivermectin is actually a is actually a generic. It was originally developed to treat people in Africa with internal parasites.
Interesting.
And my question is have you heard of it? And could a person use the original as a deterrent?
All right, thanks. Let's throw that to Dr. Sears. Dr. Sears, any thoughts on that?
Yeah, there's both a spoken question, and then I think in a lot of listeners out there, there's the unspoken question that people are always afraid to ask, which is, can't I just go down to the shop where I buy antibiotics and antiparasitic agents for my pets and buy them and use them myself? And that is something that I hear from patients pretty regularly, and I strongly discourage that. When it comes to ivermectin, there was a study published just 4 days ago in one of the big, really basic science journals that showed that if you take COVID virus and you grow it in cell culture, you actually can decrease its reproduction with ivermectin almost 5,000-fold with a single treatment of ivermectin. Can affect the COVID virus replication. It has been used in parasitic infections for a really long time, and so it is available. What it hasn't been studied in is actual humans, though. It's been mostly studied in cell cultures and inhibiting viral replication. That doesn't mean in a human that it's going to reduce the seriousness of the illness. So what we do know is when people get on ventilators with the COVID virus, there are two things going on. One is the virus is running rampant, but really another thing that's happening in those patients is their immune system is going crazy. And so it is theoretical that you could shut off the virus in those patients, but if you don't do something to turn off the immune system, you may not actually change the outcome in those patients. So ivermectin still needs to be looked at in real people suffering from the COVID virus, but in the basic science technology journals, it does look like there's a possibility that it may be beneficial.
next caller with a quick question or comment for Dr. Scott Sears. We've got Fred in Kalispell. Fred, thanks for your call. What do you want to share?
Yeah, good morning. I got the flu shot back in October, and I've been sick ever since then. My wife has been sick, a lot of mucus and that kind of stuff. But the reason I called is because 2,500,000 people die in this country on average every year. How many of those people are dying of natural causes like heart attacks and car accidents, and are they blaming on the coronavirus?
All right, thanks for that call, Fred. And maybe to add to that too, Dr. Sears, you hear a lot of people say, hey, look, we've had thousands of people die from the flu, thousands of people die from this, die from that, and we didn't shut everything down for those things. Anyway, your thoughts on both of those concepts?
Yeah, so the number one cause of death in the United States is heart disease, and it far and away outweighs everything else. Cancer is number 2. Influenza and pneumonia are number 7. They kill about 55,000 people every year in the United States, just influenza and pneumonia themselves. We talked about this a little bit a couple weeks ago, that I don't think that there's any deception going on with what people are dying of with COVID or the coronavirus. If anything, there's underreporting, because we have seen that people are showing up with heart attacks and heart disease that seem to be triggered by the COVID virus. And so if anything, the numbers we're seeing with deaths related to COVID are probably a little bit low relative to what's really going on out there, but people aren't miscategorizing things in regards to causes of death.
Well, and it's hard to look at the numbers right now to say, well, this isn't as bad as influenza and everything else, because it's based on projections of how bad it really could be if controls weren't in place. But great questions there from Fred. Next up, let's go to Joe in Whitefish. Joe, did you have a quick question or comment?
Hi, Dr. Sears. Thank you for taking my call. My call is not a medical question. I'm going to put you on the spot as a doctor. I'm a 62-year-old man. I've lived through a lot. This is by far the biggest event that has occurred in my lifetime. And we've been scared into this action. And I'm curious if you can hear the frustration in the voices of the callers. But my specific point is this: hydroxychloroquine. I heard you say that this was a drug that was created to give the soldiers to prevent malaria. That makes it sound like it's safe. Yet we have a media that's scaring people by implying the President of the United States is reckless by supporting such a drug. Doctors need to stand up and tell us what's real and what's not real when we're getting this misinformation. Doctors in my lifetime have been considered the most credible people, and now's your chance to have a voice.
All right,
to help America.
Thanks for that, Joe. And it sounded like he did give his thoughts on the on hydrochloroquine there in itself. But Dr. Sears, it is interesting that some in the media were attacking President Trump for suggesting that hydrochloroquine works, and then now some of those same outlets are saying, well, actually, there's some benefits here.
Yeah, we see this, we see this all the time, right? And physicians and healthcare providers are uniquely positioned to help people sort out what the right answer is, because people will point fingers and, change your perspective based on what they personally feel. Some people will say, hey, hydroxychloroquine's great because the person I like is touting it. And other people will say, well, hydroxychloroquine has risk because the person who's touting it I don't like, and I just want to go after them. The truth of it is you should talk to your physicians about this. They will have the current data and should be able to give you straight answers based on your individual conditions that
Dr.
help
Sears,
you know if it's right for you.
Yeah, Dr. Sears, this has been great, and I apologize that we're already out of time. Always great to have you on the show. Only about 20 seconds to go. Is hydroxychloroquine, is it available in Montana? That was a question from Henry and Bozeman. I know we ran out of time.
Yeah, so it's available, but only for people who already have a prescription for it for conditions such as lupus and autoimmune diseases, and it's available for patients in the hospital suffering from COVID virus.
Interesting. All right.
It's not available for you to just go up and buy some.
Dr. Scott Sears, always appreciate your time and your expertise. Thanks so much for being with us.